Hello everyone, welcome to Good Morning America Health. I'm Tanya Rivero. The recent debate over when women should begin getting routine mammograms has brought attention to the importance of preventative testing in maintaining our overall health. Each year, thousands of people die from diseases that simple tests could have helped prevent or treat. So here to tell us more about the importance of preventative medicine and give us some simple steps for maintaining our health is Dr. Sarah Lynn Mark, women's health expert and associate professor at Yale and Georgetown University's School of Medicine. It's so great to see you.
Thank you.
So tell us a little bit why the focus is shifting now a little bit. Traditionally, the focus has always been on treatment. And now why in the medical community is the focus shifting a little bit towards prevention?
Well, we know with prevention that when you detect a disease early or detect precancerous states, for example, you can prevent the onset of more serious disease and save lives. I really am a firm believer that an ounce of prevention is worth a ton of gold, and especially in this new economic climate. So we have shifted our focus towards trying to keep people healthy longer and trying to detect diseases before they actually become very serious.
It seems to be so logical. It makes such sense, but why has it not traditionally been so?
Well, I think, again, economics has driven the situation. Often people would not get reimbursed unless a disease was actually detected. So a lot of individuals didn't even want to go into their doctor's offices. Another area of concern is that many of the tests and just basic immunizations, for example, were not covered by health insurance, and people just simply couldn't afford it. I think the other issue is that we tend to take our health for granted unless we begin to feel ill, and then we start thinking about what do we need to do to get back on our feet.
And so how do we determine the preventative tests that would most benefit us?
Well, that's where the partnership comes in with your physician. The United States government has a lot of groups that look at what are the best preventive screens based on the science that's currently available. When you go and you see your physician, you need to sit down, talk to him or her about what some of your risk factors are, your family history, and then a decision is made when you should have your tests. We also know age is a very important factor, and that's put into the equation of when you should begin getting, for example, colonoscopy. And there is a huge debate always about mammography.
Right, so those are two that you would point to as sort of general preventative tests that are very important. Yes. Are there others that...
Well, there's a huge laundry list.
Yeah.
Recently, the Affordable Care Act was passed, and on September 23rd, many of the preventive screenings that traditionally had not been covered are now going to be covered by health insurance.
Right.
So if you have a new plan, it will be covered, and when you renew your plan, you won't have to pay deductibles or copay.
That's very good news. Now, obviously, it's fall, and you say now is a perfect time to start thinking about our preventative health. You have a couple of tips to help us do that.
Well, I think the fall is a great time. It's a time of change. Children are going back to school. Individuals are coming back from their vacations. And you're also starting to think about your end of the year tax deductions and what you need to do to get your economic house into good shape. I think it's an important time also to see what you need to do to stay healthy. So one of the first steps is make an appointment with your physician. It's a good time to see what screenings you may need, whether you need a physical exam. And even if you don't need that, to sit down and to be able to talk to your doctor about what you need to do to stay healthy, such as proper nutrition, exercise, even smoking cessation.
Now, you know, it is definitely a stressful time for a lot of people when it comes to their finances.
Yes.
But you have a tip that can help folks make these preventative visits a little bit more economical.
Well, again, at the end of the year, your health plan may need to be renewed, so this may be a good time for you to think about what prescriptions you may need to get filled, whether you need certain tests so that you can be covered. So again, I think a little long-range planning goes a very long way here.
And then how can we sort of deal with the stress that sometimes accompanies doctor visits for a lot of people?
Well, it's a really important point. There's something called white coat hypertension, which means when you see a white coat that a doctor is wearing, your blood pressure may actually go up.
Is that actually true? A lot of people suffer from that?
It is true. So sometimes you measure blood pressures a couple times, and often when I would see patients, I just didn't wear a white coat.
Yeah.
But I think what's helpful is to bring someone with you, a family member, a friend. It helps to relax you. That person can often ask questions if you forget about what you want to talk about. If you've had a procedure, they can get you home. And I also think it's a really wonderful time for bonding. I've often have recommended to patients, go out for tea, go shopping, which has its own health benefits. And that's a time to de-stress.
Now, you also say that it's important to not just have the test, but remember to follow up. Do a lot of people forget to follow up after they take the test?
They do, and this is where that partnership with your physician is so critical. When you get a procedure, when you get a test, find out when you're going to get the results, who is going to give you the results and whether you can get a hard copy of your results. We often think that if you don't get news that it's good news, and that may not necessarily be true. I think doctors' offices are just so inundated these days with so much paperwork, so much information that your results may get lost in the mail, so to speak. So it's extremely important to follow up.
You can't expect that that phone call will be coming.
You really can't.
Very, very important to follow up then. And finally, you say that now is a very good time to start thinking ahead towards our New Year's health resolutions.
Yes. Well, I think it's often important to look at the past to see where you've been and where you need to go for the future. So take a look at what your resolutions were for this year. For example, if you said you wanted to lose 50 pounds and maybe you only lost 5 pounds, think about what you needed to do to really get yourself back into speed. Mm-hmm. So, for example, if you found you just weren't exercising, start taking steps, start parking a little further and walking more. And I think, again, very simple steps are very helpful. Make your resolutions something that you think you can accomplish.
Absolutely. Accomplishing it is key. Thank you so much, Dr. Sarah Lynn Mark.